Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to everyone joining us here from around the world. I'm so excited sitting down with colleague and friend Annette Leary here today, who is going to be speaking at our upcoming GOLD Lactation Conference and going to be talking about where to start creating a lactation care plan for complex breastfeeding cases. Welcome, Annette. It's so good to have you here today.
Thank you. My pleasure. Thank you for this opportunity.
And I know you are going to be part of an add-on package on our Gold library here that's going to be part of our Gold Lactation Conference. And I'm excited because it's really taking a deep dive into the add-on package that people will be able to purchase is titled A Whole Body Approach to the Clinical Management of Complex Breastfeeding Issues. And it's so interesting, Annette. I wanted to talk to you today a little bit about the complexity of breastfeeding, why it seems so complicated at times, and, where we've sort of come from to where we are today. Because both you and I have been in the field for quite some time. And
yes.
so we've seen a lot of things, right? But let me first, by far, please tell folks where you are in the world and share a little bit about what your daily life looks like there.
Okay, great. Thank you. Well, currently I'm speaking to you guys from our second home, New Smyrna Beach, Florida. It's a little bit gray. My grandson's not too happy. He can't go to the beach today, but I usually reside in Orlando, Florida, and we come here on the weekends. I am currently in just sole private practice. I have Orlando Lactation and Wellness Services, and recently joined with an occupational therapist and another lactation consultant. We put together something called Baby Bliss Feeding Collaborative, where we kind of do an integrated approach to assessing the family, the baby, the parents, and between lactation, occupational therapy, oral motor health, and body work. I am upledger trained in craniosacral therapy. I've been upledger trained since 2015, so I incorporate a lot of body work into working with the families. It's nothing for me to throw the mom on the table with the baby laying on her and the dad touching her, or the dad will say, "Oh, my back really hurts from helping her." I'm like, "Oh, get on the table," and you get this whole wellness aspect, and everybody is leaving happier, content, and well aligned, I like to say.
Yeah, absolutely. I guess, in thinking about, I know you treat the whole family. I love that you have collaborative care. We've talked a lot about your new business and how well it's going. And it's really a bit of a dream job, I think, for a lot of lactation consultants to be in a collaborative, space, right? Irregardless of where or what that looks like, but working with others has become really the core part of, our foundational work. And it's been really exciting to have others in. So I know that's been really exciting. But thinking about this complexity of breastfeeding, and treating the whole family. So for the longest time, yes, sometimes we're very focused on the baby, how the baby's latching, how to get the baby on. And then we started thinking about, maybe the mom's, maybe some of the things the mom is going through are actually causing some of the, the baby's behavior as well. Like we're connecting the dots constantly. And I know for some people listening, this might sound really obvious, but there is really a trail of information that we need from the entire family. Just like you mentioned, the dad, and maybe even adjusting his body and how that can actually play out in the whole experience of a new parent, a new baby breastfeeding. It's incredible because it's not isolated. You can't just necessarily isolate these things, right?
Exactly, because I think many times they come in and the partner feels like, well, where do I play in this situation? Where do I fit in? They don't need me. They're providing the milk. They're providing the feeding experience. Where do I fit in? And then sometimes we have the other complexity is does this parent have support? Does the lactating parent have support of the family members there, but they're not necessarily the kind of support she may need,
right?
And teaching them how to redirect that support. So it is nothing for me to have a set of parents, the lactating parent and the partner, a grandparent, most recently, both grandparents come into the
Oh,
office. So
wow.
there are ways that I can speak to each of them to become part of this complex plan. This
Yeah.
I like to call it a recipe. I give them little ingredients for their recipe. Okay, grandfather, could you burp the baby? And can I show you a way to burp the baby? Okay, grandma, can you provide her with the food and nutrition that she needs? And the other parent, this is how you can help. She doesn't need to sleep. She's looking for sleep, but she wants to be able to feed the baby in the middle of the night. Can you get up, change the diaper, be there so that she knows you're there as part of her support network? You don't have to be fully away. So giving everybody a little bit of a piece of the recipe, a little bit of an ingredient, and it's up to them when they leave my office what they choose to do with those little bits of information and ingredients, and make their own recipe that works for them. But yeah, it is amazing. And then being able to, as you said, working in an office space with having colleagues that literally, my occupational therapist works across the table. I use a massage table being in the work that I use, so I can assess the baby, I can assess the family. Sometimes mom is sitting up on the massage table because we make it into a couch, or we make it into a
Yeah.
lounge chair. But many times my occupational therapist, Shana, has said, oh, nope, I need you to move your hands. I can't feel that suck if you move your hands
Mm.
here. And
Hmm.
all of a sudden we have a synergy, we have a flow. That's what I was looking for. And the baby starts organizing their sucking state, their I like to call it, they organize their craniosacral system, and they can now suck and swallow a lot easier. So yeah.
Yeah, absolutely. I think it's really exciting that we're now I feel like our job has really expanded as the knowledge and information, the evidence has come in about breastfeeding. Um, I also feel too, I feel a little bit, I guess, nervous for families because, what do we tell them in a normal, physiological breastfeeding state? Things really should go smoothly, Annette, right? I mean, that's the
Yeah.
reality, is that you should be able to, spontaneously breastfeed, just like I guess you can spontaneously birth. But along the way, we make choices. Sometimes those choices are made for us. Perhaps we don't have all the information. And I think that kind of leads us to some of these situations. Often I feel as lactation consultants, we're in catch-up mode. We're trying to undo and correct some of the issues that have happened, right?
Right, exactly. When we start off, sometimes it starts off with tears. We know that they're a little weepy, they're a little emotional, they're sensitive. They feel like they have failed, that they have failed their baby, that they have failed themselves, or that their body has failed them in some way. And I just simply try to start with, what were your plans before this little one was in your arms? What were your plans on feeding your baby before this? And they may say, oh, I was going to exclusively breastfeed. I said, I know it kind of is stinky when things don't go the way we had planned. Sometimes our birth is that way. Sometimes our support system you thought was going to be supportive isn't supportive. So we have to look at what we do have now and how we can work with that. So what is one thing that leaving today you would like to know? And that's how we start off. And what is one thing that we can change, or one thing that would make you feel better about what is going on? And it usually boils down to two or three things. Is my baby getting enough milk? I'm worried, because whatever has happened, whoever has put those information into their head, that, I have situations where the baby is gaining a half an ounce a day. The baby's gaining. Yes, it may not be back to birth weight at 2 weeks, but we are hydrated. We are eliminating. We are fine. It's when that little seed of doubt gets into their brain, into their ears, that they think, okay, I failed. My baby's not doing well, right? Or so it's either, is my baby getting enough? Or is my body making what my baby needs? How do I make more milk, right? And how do I get more comfortable? And it's funny to me, I go through this almost on a daily basis. How's my latch? Well, latch has many components, doesn't it? Latch has the components of, where is the baby placed? There's positioning with latch to get a deeper latch, and sometimes I'll look and say, your latch looks beautiful. You look comfortable. The baby looks comfortable. The lips are flanged, almost all of the areolas in the mouth. And then they'll say, but it doesn't feel great. Okay, that gives us more of this puzzle piece. That gives us more of what's really going on. So, it all depends on what they come in looking for. But my big thing
Mhm.
is, how did you see this? What can we fix it, or not fix, but what can we change to make life easier, more comfortable for everyone in the house right now?
Yeah,
Baby, parents, support network. And where do you see yourself when we follow up? And I always try to get a follow-up appointment before they leave. Let's have a
right.
game plan. We can follow up unofficially, whether it's a quick phone call
Right.
or, that sort of support. But when do you want to come back? And we laugh because many times, I mean, we are very blessed. Our clients love us and they come back and they come back. And I'll finally say, okay, so what are you thinking? Maybe 3 weeks? Oh no. I mean, I think everything looks good. Would you like to come
Yeah,
back in 3 weeks? No. Okay. What looks good for you? How about 2 weeks? So it's almost a weaning process I have to do with them,
right. Yeah,
almost to the point where we start checking in monthly. If for them, everything could be great and perfect, but they want that 1 month, just to make sure things are still going well.
absolutely. Yeah, absolutely. I think that just it goes to show that, the reality is when you're a new family, you want support, you need support, and you deserve it. Like it's normal behavior, to surround families when they're new, help them out, help them raise them up, all the things. And as lactation consultants, that we have just become part of that equation. And I think that that's a true testament to where
Right.
our field is and how so many of us are so passionate about making sure our families have the information that they need.
Yeah.
So yeah, it's absolutely wonderful. Well, thank you so much, Annette. I mean, always great listening to you, talking with you, and hearing all the things that you're doing. It's very inspiring, and we'll look forward to hearing your presentation, talking about where to start creating a lactation care plan for complex breastfeeding cases. Well, thank you again to everyone joining us here today. I hope that you've enjoyed listening to Annette and all the things that she's doing. Do check in with our GOLD Lactation Online Conference coming up here very shortly. You can head over to the website right now at goldlactation.com to check in on all the details. And once you register, you'll be able to add all of these add-on packages. These are deep dives into different areas, and I'm looking forward to sharing this particular presentation with you. Thank you again, everyone, and I hope you have a wonderful rest of your day. Bye-bye for now.